Hi, I'm Brad. I'm a pharmacist at Men's Health Down Under and at Coolum Court Pharmacy, which is part of the Life Pharmacy Group here in Canberra. As part of Men's Health Week that runs from the 15th to the 21st of June 2020, we thought we'd put together some little videos on common men's health issues, particularly noting that some of them can be a bit uncomfortable to talk about, and a good number of men, in fact, will put off talking to their doctor or pharmacist about these issues through embarrassment often. So, in this video, I just wanted to talk briefly about erectile dysfunction. Erectile dysfunction affects roughly 1 million men in our community here in Australia at any one point in time, so it is relatively common. Erectile dysfunction can occur because of psychological issues, and that might include having had some erectile issues previously, and that can impact on your ability to get an erection or nervousness, right through to physiological issues. So that would be an issue of blood flow, or maybe you've got high cholesterol or something wrong with the nervous system. I think it's really important to note with erectile dysfunction that the loss of strength of erection can be an indication that something else is going on. And we often refer to this as the canary in the coal mine effect, whereby it's an indication that perhaps something isn't quite right, and it's a good prompt to go in and see your local doctor just to make sure everything's in order. When I say that something else could be amiss, I'm typically referring to things like you might have some cholesterol, there might be issues with carrying too much weight or smoking, alcohol consumption, so that lifestyle things can be related to heart health. It can be related to diabetes or nervous system conditions like MS or Parkinson's disease. Erectile issues can happen for all number of reasons. Prostate cancer could be related to surgery you've had done. There can be a lot of reasons for men to lose strength of their erections. But like I say, all of those conditions are best identified and dealt with by the doctor rather than just addressing the symptoms of erectile dysfunction. Typically, the management of erectile dysfunction is pretty straightforward, assuming that there's nothing particularly wrong with the patient. It can be managed with oral medications, it could be managed with injections, it can be managed with a vacuum erection device. So there's a lot of different treatments, so no need to panic if one's not particularly safe for you or appropriate, or you have side effects from it. There's a number of options, right through to getting a prosthetic implant done by a urologist. So there's a lot of options. There's a lot of discussions to have with your doctor or with your pharmacist or the urologist in terms of figuring out what might be best for you. But assuming there's nothing else wrong with you, which is really important for the doctor to figure out, it is pretty easily managed. And the quality of life for the sufferer is dramatically improved, often just by taking a simple tablet. I do believe it's really important to get in and get those checks done. So please, if you're suffering with any erectile issues or a loss of strength, get in and see your doctor so that they can check all your pathology and make sure you're in good health. And remember that canary in the coal mine, really important. Certainly, if this has raised any questions for you and you need to get in touch, feel free to reach out to us at Men's Health Down Under or the Life Pharmacy Group. Your general practitioner is a wonderful source of information and has the expertise to diagnose what's going on and run the pathology and the checks and balances. And rest assured, if anything does come up, the urologist that they will likely refer you to, is an expert in the field and will be able to help you out. So during Men's Health Week, we're wanting to make sure you're on top of your men's health. So please help spread the word and let's get our men in a better state of affairs. Thank you.